lecture class on orofacial pain. I am Dr. Katpagavalli from the Department of Oral Medicine and Radiology. Pain is defined by International Association for the Study of Pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. There are various tools available for the assessment of pain, which may be unidimensional, multidimensional, or observational. Few of unidimensional tools include visual analog scale, which is a common and simple method with a 10 cm line labeled at one end as no pain and at the other end as the worst pain imaginable. The category 4 point assesses pain as none, mild, moderate, and severe. The numeric pain scale uses numbers ranging from 0 to 10. Multidimensional tools include McGill Pain Questionnaire and Brief Pain Inventory. Observation of pain behavior includes limited function, guarding, decreased appetite, decreased oral hygiene, impaired interpersonal relationship, and regular absence from work. The most essential part of pain assessment is the evaluation of patient, especially history taking, in which the nature of pain should be recorded clearly. Physical examination should be done by sensory discrimination using a small sterile needle or pin, cranial nerve testing, assessment of reflexes such as blink, gag, pupillary, and jaw jerk reflexes, and examination of muscles of mastication. Finally, a detailed intraoral examination of mucosa and dentition is essential. Diagnostic studies include chairside procedures such as LA block test and vapor coolant spray, detailed craniofacial imaging studies like X-ray, CT, MRI, and electromyography. Now we move on to the classification of orofacial pain. This comprises of neuralgia, which is pain in distribution of nerve. Neuralgias causing orofacial pain are trigeminal neuralgia, postherpetic neuralgia, glossopharyngeal neuralgia, occipital neuralgia, and geniculate neuralgia. Glossopharyngeal neuralgia affects ninth cranial nerve and is characterized by paroxysmal pain along the pharynx, posterior tongue, and ear triggered by chewing, talking, and swallowing. Geniculate neuralgia affects 7th cranial nerve with pain in ear, anterior tongue, and soft palate associated with facial paralysis. Postherpetic neuralgia is characterized by pain that persists longer than a month or 3 to 6 months in herpes zoster infection, that is shingles, after the vesicles have healed. Prevention includes administration of antiviral drugs along with systemic corticosteroids during the acute phase of disease. Treatment is by topical anesthetics, analgesics like capsaicin, tricyclic antidepressants, gabapentin, and carbamazepine. Pain of musculoskeletal origin is due to temporomandibular disorders, myofascial pain dysfunction syndrome, myalgias, and Eagle syndrome. Primary vascular disorders include migraine, tension headache, temporal arteritis, angina pectoris, and cluster headache. Psychogenic pain are atypical facial pain, hysterical, delusional, and hallucinatory. Of the primary vascular disorders, migraine is the most commonest one, characterized by severe unilateral throbbing headache, nausea, vomiting, which lasts from few hours to 2 to 3 days and responds well to ergotamine and sumatriptan. Tension headache, commonly known as stress headache, is characterized by mild to moderate, bilateral, constant band-like pain, tightness, or pressure around the forehead, which lasts for 4 to 6 hours. Management is by administration of non-steroidal anti-inflammatory drugs and tricyclic antidepressants. Cluster headaches is characterized by episodes of severe unilateral pain in and around the eyes with multiple headaches per day for 4 to 6 weeks and pain-free for months or even years. Treatment is to breathe 100% oxygen, lithium, and ergotamine. Temporal or giant cell arteritis is an inflammatory disorder of temporal artery characterized by throbbing headache with fever, malaise, and loss of appetite. Management is through administration of systemic corticosteroids. Sinus pain is referred pain from the maxillary sinus characterized by moderate to severe pain over the frontal sinus or maxillary sinus region. Other ENT related causes are otitis media. Generalized pain syndrome includes post-traumatic pain, causalgia, phantom pain, and central pain. Pain may be due to lesions of the oral cavity, commonly being pulpal pain, periodontal pain, impaction, occlusal trauma, osteitis, mucocutaneous diseases, glossodinia, and cystin tumors. Finally, Pain may be due to salivary gland disorders such as ductal blockage, gland tumors, inflammation and infection of the salivary glands.